Good evening, everyone. I am Dr.V Mohan. Thank you for joining us on Facebook Live. This is a series of programs that we have been doing, dealing with various people with diabetes, and it's about diabetes. Mostly the focus has been on type 1 diabetes, and in earlier programs we've had many people with type 1 diabetes come and share their stories publicly with all of you. We've had people with type 1 diabetes themselves coming, and then we've had parents coming, we've had a husband who spoke about it, we have children who have come, we have had another type 1 person who runs a marathon, he had come. Last time we did the show, we had Mr. Asin Chako, who was thought to have type 1 diabetes and later turned out to have Modi type diabetes, so we were able to completely stop her insulin. So in continuation of this particular series and on the theme of type 1 diabetes, I'm very happy to present to you today a very special guest that we have. Dr. Ashish Bondia is a medical doctor by profession, and he is the medical project director of health of the Hinduja Foundation. As you know, the Hinduja Foundation is run by the Hinduja Group, and they've been doing extensive charity in many different areas. And Dr. Ashish Bondia completed his medical education at AFMC Pune, and then he also had a degree in management from the Indian School of Business ISB at Hyderabad. He has been associated with many projects in the past, including those with the Clinton Foundation. He has worked on tuberculosis in the past, and now, of course, he has taken up a very important position as Program Director of Health at the Hinduja Foundation. So welcome, Ashish, welcome to the show. Why don't you tell us a little bit about yourself and also about the Hinduja Foundation? What are the areas in which the Hinduja Foundation supports, and some of your activities? And then we'll go down to a specific project that you are supporting in India on type 1 diabetes.
Thank you so much, Dr. Mohan, and warm good evening to everybody joining. So I, Dr. Ashish Bondia, I work primarily in health access and patient advocacy. Like mentioned earlier, I worked with the Clinton Foundation and the Indian Army Medical Corps, and I've set up a social enterprise on non-communicable diseases as well for urban slum dwellers in Hyderabad. And I've been with the Hinduja Foundation for the last 2 years. One of our champion causes at the Hinduja Foundation is the type 1 diabetes program. I'd like to tell everybody a little bit about the group and the foundation. Our group, as many of you know, is a 100-year conglomerate founded by Sri Padmanabhan. We are very diversified.
On and off, we are losing you. Once part of sentence coming, part of it is not coming. So there's some little audio problem. Anyway, carry on. You can. Yeah.
Okay, so I'll be brief on this. So we've got about 150,000 employees across 38 countries. We've got investments in media, in entertainment, in information technology, automotive, banking, financial services. And through all the expansive work of the group, there's one credo, there's one motto of our founder, which the group follows, which is my duty is to work so that I can give. My dharma is to work so that I can give. And from that came out the Hinduja Foundation, established about 3 years ago. And we've got champion causes across different verticals, main areas of focus. We have water and we have education. And we work in different parts of the country for different projects based on the need and where we can most create impact towards the sustainable development goals. With that, I think we should now pivot to the program at hand, that is the Type 1 Diabetes program, where we are very honored to partner with Dr. institutions in Chennai, as well as 2 other partners we have in this journey. Ranjan Yagnik, who's leading the diabetes center in Hospital in Pune, and our own Hinduja Hospital in Mumbai, which is where this work is being led by three endocrinologists, Dr. Nishan Shah, Dr. Manoj Chadda, and Dr. Dr.V Mohan. And the next few minutes, we'll talk a little bit more about the work that we've done in this program, and to hear from everybody else questions, queries around this work, and how we can best engage further as well.
Thank you, Ashish. As I mentioned on and off, there was some voice break, so I'll repeat what I was able to hear, but maybe the people who are hearing there outside might not have heard all that he said. So he talked about the group and all that the group does. They are a very diversified group. But then to the founder, he mentioned that he works so that he can give. So that is a very great philosophy, which I also was very impressed by. And he mentioned the Hinduja Foundation, which is set up by them to specifically help, and I believe they work in many areas, including type 1 diabetes, drug-resistant TB, cancer, and mental health. These are four of the areas, but they also help other areas. So we got in touch with the foundation when Mr. Dheeraj Hinduja contacted us some time ago and told us that he was interested to support children with type 1 diabetes and others who needed support, primarily from the lower socioeconomic group and those who are financially weak. And with that started this project, which we call as the T1D1 project. T1 is type 1 diabetes project. So it's DI for diabetes. So T1D1 project. Now, this project, as Ashish was saying, I'm not sure whether you heard it, is being run in three centers in India: the Madras Diabetes Research Foundation, with which I am associated in Chennai, the KEM hospital and the diabetes unit run by Dr. Ranjan Yajnik at Pune, and the KEM hospital itself. They have their own charitable hospital in Mumbai, where they have their own group which is working on this. So the way the foundation does is that in these three centers, we select people with type 1 children, primarily with type 1 diabetes, who cannot afford anything. They cannot afford insulin, they cannot afford treatment, and so on, and then support them by giving them not only free treatment and free consultations and free insulin also on a long-term basis, but also do all the diagnostic tests, give them their supplies of glucometer strips if needed, ambulatory glucose profile and the AGP sensor which you put on the hand, and then look at that. And finally, even to some patients, really deserving patients, we've even given the very expensive insulin pump. No, not the expensive model of the pump, but insulin pump. Even the lowest model is quite expensive. But in children who otherwise really needed this, we have been able to give that thanks to the Hinduja Foundation. In fact, many of these children and the families have expressed their gratitude in social media, saying that they're alive only because of this kind of a support which is being given. So we are very, very grateful to Ashish and to the Hinduja Foundation for supporting us. Now, Ashish, the how many patients in total between the three centers are now being supported by you with type 1 diabetes?
We've enrolled so far over 600 patients, and hope, we expect to enroll a few more over the next few months. And unfortunately, that's one of the impacts of COVID, having an initiative with of this magnitude get slightly derailed, given patients cannot travel easily to hospitals.
Yeah.
And we've seen different kinds of impact across the different centers. And slowly, steadily, I think we are getting back to enrolling as many patients as we could.
Very good. So, I mean, this is not a small number for one foundation to support. 600 patients across these three centers on a long-term basis, giving them all the treatment, the investigations and the treatment and the consultations and the insulin and the glucose supplies and the glucometers uh, and everything is something which I think is very, very magnanimous of the foundation. And I can't thank the directors and the staff and you, Dr. Ashish, for looking after this. It's not just like doling out money. So you come here, take some money, and then go and have your treatment, or just saying, "Yeah, here's your insulin, take this and go." It's not that. I think it goes far, far beyond that. It's a question of touching lives of people. And before I show you some of those stories, you must also have been quite happy to see some of the feedback, and I'm sure the directors of the foundation also would have been very happy. So, to you, what is something which makes it heartwarming and soul stirring and satisfying to support these children?
Um, that's actually a very good question, and one of the things that really moved me uh, uh, when I started engaging with the three centers and the patients around was how other patients are willing to give back. So this concept of diabuddies, or where patients are supporting other patients. Some of the patients are obviously on treatment support from the foundation, but other patients are also far along in the journey, have reached adulthood, and are socioeconomically themselves independent. They are willing to come forward and help other type 1 diabetes patients in this journey, because type 1 diabetes is not just giving insulin and you're all right. It's also managing life, living with insulin injections or throughout your life. It is so what you need is not just insulin. You also need
Psychological
lifestyle.
support. Yeah.
Absolutely, absolutely. I mean, we're running these multiple series of how we can um, give psychological support to patients, their parents, their caregivers. School teachers need to be engaged and made aware. And these are the important things where a lot of the patients are stepping up, uh, not just the people who need treatment support. They are, of course, associated with the multi-centric registry, but also these patients who are uh, the, also these patients who can give back. And this has been extremely moving and heartwarming to me.
Thank you. When you mentioned that, I remembered one of our, one of my PhDs, one of our PhD students with type 1 diabetes. He is now doing extremely well for himself. He is now in the United States. He's an independent scientist of his own accord, and he has got his own grants, and he's got some fabulous contributions he has made, especially in the field of diabetic retinopathy, where he works. But when he was doing his PhD at our center, I must tell the story. So I would go for rounds around this time, 7:30 in the evening, and his work is until 4:35 in the evening. He's a researcher, and then he's done by 4:35. He should be gone, and then I'll be making rounds at 8 p.m. And as I'm walking around, I'll suddenly find him in the ward. And he's not a doctor, so he need not come to the ward at all. He's a pure scientist who works in the lab. So I'll find him, in the ward, and I'll say, "What are you doing?" No, 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 no. I heard that the new patient, a new child with type 1 diabetes has been admitted. I know how anxious the parents will be. So I just came to say hi to them and to encourage them, saying that, type 1 diabetes is not a big disorder. And it's not that he'll just come and say hi and then leave. He'll spend an hour with them, talking to them, saying how he takes the insulin and how it's not a big deal and how he has lived all his life, and so on. And you won't believe how attached people get to somebody like that. They're able to empathize with them much better because they also take the insulin. In fact, there are patients who have asked me to my face, "Do you have type 1 diabetes?" No. Then you will not know. You don't know the pain, doctor. You can talk whatever you want, but taking that insulin 4 times a day throughout your life is not a joke. And only somebody who's gone through it will be able to empathize. So I remember this Dr. Sampath, who was, and so we honored him recently. He also got, some extraordinary research done. And when we honored our alumnus, the best alumnus of the Madras Diabetes Research Foundation, he was the first recipient last year. So we gave him a gold medal, and he came to receive the award in Chennai. And one of the aspects which he talked about, which we talked about, is that he has his human side. It's not just research, it's not just publication, it's not just his growth in the profession, but his the humane touch that he has. So you very rightly mentioned about the dia buddies, and because they're able to empathize so much with other children with type 1 diabetes, and that is how it makes a big difference. We also have at our center something called as Friends Forever, which is run by my team, led by Tangamani and others. And every second Saturday we used to meet. Of course, with COVID, everything, as you said, has got stopped, but we'll be restarting it. So they come together, those who are newly diagnosed, and then we get some of the older ones to come in who have lived with it for years, and they come and give motivational talks. And this has been a game changer as far as the family is concerned. Oh, he has been taking it. See, he has become. So then the child also gets a lot of confidence. Now, among the people whom you have supported, there have been some remarkable stories which I have shared with you and with the foundation. But people may not be, people may not really appreciate, how lives of people change when you support them, and what that support means. So maybe with your permission, shall I share a few slides?
Absolutely, sir. I think that'll be great for everybody here around here to know how impactful this entire initiative has been.
Very good. So can we have the slides, Sundar? Okay. So for those of you who have just tuned in and you might have missed, we have this amazing project. We call it as Mission Type 1 Diabetes. It's a mission. It's not just a project. We're trying to change the lives of people. So we're also trying to improve the natural history, improve the survival of people, and the follow-up of patients with type 1. Now, follow-up is very important because children come and then they take their insulin and then they disappear. They don't come back for 2, 3, 4, 5 years. And that's the time when all the complications occur, unfortunately. And the cases I've selected to show you today, of course, I've taken permission from every one of them to share their stories with you. But they all have something even in addition to type 1 diabetes. Type 1 diabetes, taking insulin itself is one part of the story. But then if you have other problems on top of type 1, then it makes it all that much more difficult. And that's where it really comes in. So as I said, we call this program as a T1D1, the Type 1 Diabetes Project. So T1D1 is funded by the Hinduja Foundation. And these are the three centers: Dr. Mohan's Diabetes Specialty Center and the Madras Diabetes Research Foundation, the King Edward Memorial Hospital, the KEM Hospital Research Center in Pune, and the PD Hinduja Hospital and Medical Research Center in Mumbai. So these are the three. Now, I'll show you some case presentations. Next slide. Now, let's take this particular girl. I'm not telling the name of anybody, but this is, we'll call it as case study A. She's a 21-year-old girl. She was referred to a center by a doctor. She had chicken pox at the age of 3 years, and just after that, she got diabetes. We don't know. We know that viral insults can lead to diabetes. We're not sure that chicken pox had anything to do with it, but anyway, she was diagnosed. We measured a C-peptide, which was absent. This is the measure of how much insulin is there in the body, and it came completely absent. So which means that it confirms the diagnosis of type 1 diabetes. Next slide. So her father was a construction worker. That's her father and that's her mother. They are married in the same family, but I don't think that is related to her type 1. She has no other family support. She has 2 siblings, students, so both are studying. So you can see here is one girl, and the family is a construction worker, and you support 2 more children. Okay, family history of type 2 diabetes. I think one of them had a father or mother had diabetes, but that has nothing to do with her diabetes. This is very different. Next. She came to a center with very high blood glucose levels. I think it was something in the range of 400 or 500, if I'm not mistaken. And during her first visit, she had no diabetic retinopathy. Now, normally what we think that they have is diabetic retinopathy. Okay, she didn't have that, but she said she was having some visual problem. And so when we looked at her picture, we took a picture of her eye. we found that fundus photograph, we found that she had what's called as primary optic atrophy. This is the optic nerve which comes in the retinal picture. You can get that. It starts getting whiter and whiter, and that's called as optic atrophy. So what she actually had was not just diabetes. She had another condition called as DID mode syndrome. Now, DID mode stands for diabetes insipidus. So she has not only diabetes mellitus, which is DM, she also had diabetes insipidus. Okay, it's an independent problem in the pituitary gland. And then she had optic atrophy, which is OA, plus she had deafness. So she had diabetes insipidus, she had diabetes mellitus, she had optic atrophy, and she had deafness. Now for this is also called as Wolfram syndrome. Now for this, some genetic testing has to be done to really confirm this. And this is where the Hinduja Foundation has been really helping us. And Ashish is just looking at some of the results. We are talking about what happened to those who had Modi genetic testing and so on. This girl was one of those who was diagnosed through because little atypical kind of diabetes. So we looked at it, and then we found that she had the gene defect. And thanks to your genetic study, we were able to accurately diagnose this girl's condition. Otherwise, but I just thought it's type 1 diabetes, but she actually had much more than type 1 diabetes. So we advised her insulin. We gave her diabetes education. This is when she first came. Okay. And then she was lost for, go back. So she was lost for follow-up. She said, oh, I could not afford it. See, we treat a lot of people free, but there's a limit to what we can also treat as free. So at that time, she had actually, you remember in that first slide, I said follow-up is very important. So this girl was lost for follow-up. She was going to some clinic somewhere, and she was taking insulin very irregularly and so on, no follow-up at all. When we got this support, we started calling back people and saying, you know what? You come now, we will give you free insulin, we'll give you free treatment, we'll give you everything. You don't have to pay 1 rupee. Please come back. So she came back. But by the time she unfortunately became blind, not because of diabetes, but because this optic atrophy has set in. This is a separate syndrome called as where optic atrophy and deafness comes in this. Unfortunately, she became blind. But even now, she's very grateful that this could not have been prevented. It's a genetic thing and we could not have prevented it. But even now, she's very, very grateful because you're supporting her treatment under Hinduja projects. At least the money part, she does not have to worry about. The family, at least one problem solved, money problem solved. And so now she's regularly taking insulin. The rest of her health is okay. Otherwise, she should still be okay, except that her vision has gone down. We're trying to help her regarding the vision also. Next slide. Now, this is a second child. I'm just showing you how the support from a foundation was able to get people back to us and continue the treatment where we could not do that earlier. This is a 17-year-old boy. You can see that, he had diabetes diagnosed age of 14 because he doesn't look like 17. He's stunted because for the first 3 years, he was not taking proper treatment, irregular insulin, not able to afford, and so on. Now, in addition, look at the problem he had. He had epilepsy, he had fits, and he had pulmonary tuberculosis. So he's got 2 additional problems apart from the type 1 diabetes. Next slide. Now look at additional problems now. Not only he has got type 1 diabetes, his mother is mentally challenged. Okay. So she doesn't know much. She's kind of completely mentally challenged. Part of that could have been because her father left. Maybe because of this boy having diabetes or whatever, the father has run away from somewhere else. Gone away somewhere else. Only this mother is mentally challenged. So she also cannot look after the child. He has no siblings. Okay. And now this boy is staying with the grandmother and a maternal uncle. That's all he has now. Mother's brother and mother's mother is looking after. He was taking treatment in some hospital. He stopped his education. Now look at the story. It almost made me cry when I saw this. He stopped his education after 10th standard just to support himself to get insulin because he has to live. His uncle and his grandmother, father may not give him the support. His father is not there. Mother is not earning. No siblings. Where will he go to survive? He knows he needs insulin. He's got it when he's 14, so he's old enough to know that. So what he did was he stopped his education and started working, some coolie work or some labor he started going. So that with that money, he can take insulin and be alive. Can you see, when you think of type 1 diabetes, you only think about, oh, they have to take insulin. That is for those who can afford to take insulin. What about those who cannot afford to take insulin, who have to be like this boy? It is very, very, touching. It is, makes you cry. And now for 2 years, he was only working to pay for his own treatment. Okay, in the age of 14 to 16, 17. Somehow he came to know through someone That is why we're doing such programs. Why do you think we're doing this on Facebook Live? We are not doing this to say, oh, we did so many people we treated, we did this thing. No, we're not doing that. We are saying this because there are institutions like the Hinduja Foundation which are changing the lives of these people in our country who are not able to take the treatment. It is not just insulin. You're changing the complete life of this person. So he came to know about the free treatment offered, and he approached us and said, can you include me? I heard there's some scheme. Can you include me? Next slide. So you can see his response shown here. Now, this is what is called as AGP, or ambulatory glucose profile. Now, this, when he came to us on 12th April, you can see how his sugars were. Now, this yellow thing tells you this kind of mountains and peaks that you're seeing shows that the sugar is not under control. Now, there's something here. If you see it carefully, it's written time and target. He had 9% of the day under control, and then 0% of the day under control, 0% of the day under control, 0% of the day under control, 100% of the day out of control, very high. And then we started him, changed his insulin, we adjusted the insulin dose. His HbA1c is 14.4. For those of you who are, some of you have come on my show and told me your HbA1c is 6.5, 6.1 and all, even less for some of you. Look at his HbA1c, 14.4, okay? And so we completely adjusted his insulin, gave him education, gave him a free AGP, gave him a glucometer, gave him free insulin 4 times a day. And then now you can see how his sugars have improved from 0% control. It has become 39%, 57% under control. Something like 70% is considered good control. This is only in the first week. And as you go on, it gets better. Is there another one of the next week? No, it's okay. So anyway, the next week it got even better. So he wrote, this poor fellow, next slide. He writes on social media and thing, I am a type 1 diabetes patient from poor family background. I'm just 18-year-old. These are his mistake. He has typed it. I had to earn for my medicines. I left studying for the sake of this. Today, I'm extremely happy and grateful as Dr. Mohan's hospital has provided me insulin, AGP, and glucometer, all completely free, funded through the Hinduja Foundation. Now, one person like this, if you're able to get the support of just one person like this, I think it's made our day, because I think we have completely changed the life of this one particular person. But this is not the only one. There are 600 people like this whom you're supporting.
And the way I look at it, sir, is that there's multiple times return on this investment. This boy is going to grow up. He's going to become. He's going to go back to his studies. He's going to, earn a living and become socioeconomically productive. And he's got a long life ahead of him, which this support can catalyze into making help him reach his potential. And just like him, there are these other children all across the 3 centers that we're supporting, which is what the entire genesis of this tidy project is, to see how we can support these children achieve the fuller potential that each one of them has.
I entirely agree, Ashish. That point that you brought up, I didn't think about that. That not only we are helping now, but you're helping him to get eventually he can work for a living, because he doesn't have to then spend it on this. So then he can eventually settle down. He can get married. He can have children, and maybe his son will support him later on in the future. And so you're building up a whole generation of people through the support. It's not just giving insulin and then you take your insulin and go. It is not like that. So I think changing lives is very important. We have a few more stories. Next slide. This is another sad story. These are 2 siblings. We're just calling them C and D. There are 2 siblings with type 1 diabetes. They also belong to a low socioeconomic group. Again, hearing about the free treatment offered from a hospital, they were referred through a regular patient of a hospital. Somebody came and then saw these children. How was children? Oh, no, we're giving them free treatment. Oh, then I have, a neighbor. I have 2 children. Can you take them on? Yes, of course you take them on. So they came. All the tests, medicines, everything was given free of cost. Next slide. Let's see these 2 children. So the first one, age at onset was 3 years, also had a stammering issue. So in addition to diabetes, stammering also. Epilepsy was also there. Now, see, we think cataract surgery and all that comes when you're 50, 60 years old. You can have juvenile cataract. Part of it is because of uncontrolled diabetes. So this child had to undergo cataract surgery in the year 2017 for the eye. Then we looked at the ultrasound of the abdomen, because we do a complete examination. We don't just do sugar and thing. We do a complete, even for the free patient, we do everything. So when we did the ultrasound, we found the liver was a little enlarged. So then, and they had very high sugars. So we changed the insulin, and now the sugars are under very good control. Next slide. This is the next sibling. Age at onset is 6 years. Again had cataract surgery. So you can see both the siblings, maybe some genetic factor. Both, and this is the girl now. She also had cataract surgery. Cataract surgery was done in 2010. Now she had polycystic ovarian disease since 2018. Now when we did the ultrasound, we found that she had bilateral hydroureteronephrosis. That means the kidney is swollen, the ureter is swollen, and if you don't treat this, then this can lead to damage to the kidney. We were able to fix this. We were able to do that and gave her the treatment. We have given her 4 times insulin per day, and her sugars have got under good control. So again, I think this, through this, otherwise they would have been just, they would not have come into a specialty clinic at all. They'd be going to a GP or somewhere and taking some insulin and staying alive, and eventually all the complications would have come. Next slide. Now, this is yet another sibling pair, brother and a sister with type 1 diabetes. Father works in a pharmacy. Mother is a housewife. They have no other social support. Next slide. Brother got it when he was 3 years old. He had giddiness and excessive urination. And then on 25/9/2019, he was hospitalized with high fever and abdominal pain and severe uncontrolled diabetes. Blood sugars are extremely high. Next slide. So we did the HbA1c. He was on 3 times insulin. We changed it to 4 times insulin, gave the basal. He was not taking basal insulin at all. And that's why sugar is not under control. Once we switched over to the correct insulin regime, the sugar settled down. We educated the child, the boy, what to do, and support was also provided. Next. Regarding the girl, she got diabetes when she was 10 years old. She has also been on insulin. Again, she had very high uncontrolled diabetes. We gave her a free AGP. We gave her insulin dose adjustment based on the AGP. And then with that, the sugars got under very good control. Next slide. This is a very interesting story. There's a 21-year-old girl. She came to a center from Harur in Dharmapuri district. Her age at onset is 12 years. She is GAD positive and C-peptide was absent. Father was in the textile business, but due to loss in business, was unable to afford treatment. He became totally bankrupt. Mother is a housewife. They were married in the same family. Next slide.
So do you think that is there a genetic reference to type 1 diabetes, or
there is? Oh, there is. And so I briefly mentioned it to you once. Till recently, we have been only focusing on MODY, DID-MOD syndrome, monogenic diabetes, neonatal diabetes, for which we are the premier genetic center in the whole country. We are an ICMR recognized center for genomics of the monogenic forms of diabetes like MODY and so on. But more recently, Dr. Radha and her group, she heads our genomics division. We are also setting up a separate genetic test only for type 1 diabetes. It's called as the type 1 diabetic genetic risk score. T1GRS, we call it, genetic risk score. It's just being standardized. It was just getting ready when COVID hit. Everything about 4 or 5 months we have lost because of this. But now, and the lab opened only in August, I think. So now they are back in the lab and they have started doing all this. And so very soon, we'll be at least in these borderline cases where we are not sure whether it is type 1 or it is MODY, and we are still not sure, clinical features, GAD didn't help, C-peptide is intermediate, something like that. There, this genetic test will help. So, see, the consanguinity in this particular family suggests that there is some genetic factor. Maybe that's why 2 already we have seen where the father and mother have in the same family. So, gene could have got multiplied. And maybe that's one of the reasons why they got it. Now, this girl is very interesting. She was lost for follow-up for more than 6 years. Okay, she didn't come back at all. We motivated her to come back for the follow-up and for free treatment provided through the Hinduja Foundation. When she heard about this, we were very surprised. Her marriage was take place within 2 days. 2 days later was a marriage. So very surprised. She came and said, I came to also invite you for my wedding. It's day after tomorrow. And I said, what are you doing here? You should come after you're married. She said, no, I still came because the letter came. I was so touched. You still didn't forget me. 6 years I didn't come. You still remember me. So I thought I should come and tell you about my wedding and then go. And they were so happy. And then we got her sugar under good control and told her, okay, now you're getting married. Now we'll have to plan for pregnancy and all that later. Till we tell you that your sugars are well stabilized, don't get pregnant, because then abortion and all that can occur. So still a lot of work to be done. So we have brought her back. So this has been one of the things when we applied to the foundation, saying that we're losing a lot of people whom we otherwise would not have been able to give this high quality care. And so now we are very happy that they are all coming back. Next slide. I think this is the last one. So this is a 12-year-old girl who was referred to a center by her mother's employer. So the mother's employer was taking treatment with us, and she said, I've got this particular girl who's working in our office, who has got a 12-year-old girl, and she is having all kinds of problems. Can you take over and treat? I heard you do some charity and all that. Can you take over and treat? They said yes. She had some, she had type 1 diabetes. C-peptide was absent. Next slide. And here again, look at the story here. Father died due to congestive heart failure. This is a brother. Okay, so father died due to congestive heart failure. Mother has a hearing disability. Okay, so mother has a hearing disability, and she's working as a housemaid. So this housemaid, this lady's boss, who in the where she's working, she is the one who came as a patient, and she said, I've got this maid, her child is there, you must look after. I said, definitely send. So she came. Brother is a student. Now this girl, this lady, has to support this boy who's a student, pay for him, and also the insulin for this girl. Now see, now the girl is looked after. Now the boy can be looked after by her, from her thing. So as you said, it's not just one person's life that you're helping. You're helping the boy is helped because of this now. Otherwise, with this being a housemaid, how will he would have stopped education after some time. Father is not there. So what do we do now? Okay, and look at sugars. When she came with very high sugars, we started treating her, and you can see that a remarkable improvement in the sugar from 187 fasting. It's come down to 100. Next one.
Before we go there, sir.
Yeah, sorry.
Before we go there, sir, how do you see COVID has impacted the ability of these patients to access care at Dr. Mohan's? And also, it'd be good to hear your views on how COVID has impacted care delivery across the country as well.
Yeah. So what we started doing was that it did impact. So, I mean, first of all, think about it. People are scared to come, they especially first 2-3 months. Now that fear has gone down a little bit. But imagine the first 3 months, people were so scared, hearing all about this. And especially if you have diabetes. Oh, if I have diabetes, the risk is more. And there were actually 1 or 2 deaths in type 1 children with. There was in Ahmedabad, there was one, and in Tamil Nadu, there was one, 18, 19-year-old. I think both were girls. But I heard in both cases, there was some comorbidities. They had some kidney problem, something else. But we know of at least 2 deaths. It could be more with type 1 diabetes and COVID in India. So even leaving that alone, they're so scared to come to the hospital. So they said, we'll do whatever you want. So what we did was we reached out to them and said, we will deliver the insulin to you. Okay, you got glucometer with you. So why don't you do the glucometer readings and send it to us through telephone, through email, WhatsApp, whatever is possible for you. You send it to us, and then we will. So our team was actually keeping in touch with them, although they could not physically come. So about 2 months we lost. I think half of March and April went off. From May, we started telling them, please try to come back. Now I think they're all coming back now. We'll have to see how much of the control was lost due to that. I don't think very much, because once you're in touch with them, if you leave them off, then they will go off like that. But once you're in touch with them and encourage them to take the insulin, to test and so on, I don't think much has been lost. And within 2-3 months, we've got them back. So I think it's a very valid question, but I think they're okay there. So I think this is the last boy, 13-year-old boy. Father was a laborer, mother's housewife, 3 siblings, all students. Came to a hospital, very high blood sugars, admitted. We had to admit this person, this boy. Next slide. And you can see where the sugar was. Hit the ceiling, 450 or something when they came, and then from 280, then you had one low sugar reaction, and then again it went up, and now it's again down again. So from somewhere there where the sugar was, now it's all coming down, and with adjustment of the dosages, now this boy is doing very well. That's the last. Yeah, so that's a lot. So I won't show any more cases, but this is just to give you a flavor of just a sample of, we have 200, 250 patients now under this scheme that you have been supporting. All of them, of course, get free treatment. Almost all of them get free insulin. And some of them have already had glucometers, so we didn't need to give. This AGP we try to put for almost everyone to get the first round at least, so that we know how the adjustment of the insulin is. Some of them have had even the genetic testing done to rule out whether it's really type 1 or MODY. You are kind enough to pay for that also. But uniformly, all of them have done really well. And more than anything else, the happiness in their face when you see, when they come to you and they are really, really grateful. I didn't show a picture of one of the patients, or one or two of the patients in whom we gave insulin pump. And so that has been another, we can talk about that also.
So, who do you advise insulin pumps within our cohort or generally as well?
See, type 1 diabetes is a condition where the blood sugars keep going up and down, up and down. And some of the, even people who came on this show who have had very good control have been on pump. And therefore, pump kind of smoothens out the control. One definite indication for pump will be what we call as brittle diabetes. So brittle diabetes is when you have, like the other patient I just now showed you, this boy, you saw 62 followed by 480 and then coming down, again coming down. Now that's the kind of a person who would benefit from a pump. When you try to adjust the dose, 2 units you give, sugar will go down. So, okay, we'll reduce 1 unit, it'll go so high. Then you say, no, I'll give 1 unit more, it'll keep going down. So whatever you do, it becomes very difficult. Of course, with the continuous glucose monitoring, it becomes a little bit more easier. Not all type 1 patients are like that, but some of these children have extreme fluctuations of sugar. And in that kind of a situation, a pump will help. And the few patients to whom we have given the pump, both through your foundation and also on August 3rd was my late wife's birthday. So my daughter and I donated a pump to yet another child. We said, let us do it. She wanted to say it. She said, my mother's name, why don't we do it? So both of us split the cost and we gave. We gave the pump. And then for the costs, for the running costs for the whole year, we said we'll again split that half. So she'll pay half and I'll pay half. So we are helped one more child on August 3rd. We gave that. So these are all, I mean, small things, not very big things, but life-changing. As far as the particular family is concerned, it's definitely life-changing. I hope the directors at the Hinduja Foundation are getting all this feedback and they're also happy about this.
Absolutely. I think at the foundation, we're very, all the information and the feedback that we've received from all 3 centers, from Chennai, from Pune, from Mumbai, has been very heartwarming. How we've been able to actually create value, create impact, and support patients in this journey towards better control of blood sugar. And when we started out, one of the things that was outstanding in the landscape was A, there's less awareness. B, we need more treatment support for patients. And also, lack of data. There's not enough research on this in the country. And so that's one more thing that the foundation is very excited about, that across the 3 centers, we are using a common performer for data collection. And we are being able to track clinical progression. And this will throw interesting insights as we move forward.
Correct. Because it's only been a shorter period now, but as we go forward, say 4 or 5 years down the line, remember one point which viewers also must understand is, let us say that I told you the HbA1c was 14 for that particular boy. Okay, we wanted below 7. Okay, now that's a huge jump. From 14 to 7 is a fabulous jump, and if you can achieve it, it's great. We may not even achieve it in everyone. It's difficult. For type 1s, everyone coming below 7% is not so easy. But let us say From 14, we brought it down to say 10 to start with. Okay, 4% drop. What many people may not know that a 1% drop in A1C can reduce the risk of complications by 25%. 1%. So suppose from 14 to 10 we bring it down, the risk has, his risk or her risk has been brought down almost by 100%. And having then achieved 10, we can then try for say 8, and do the best that we can do. So another 50% risk, that means 150% reduction in the risk of what they originally had. So suppose the original risk was 250%, now 150% we have reduced it, so now only a little bit more to go. So that is something which you talked about, the economic benefit of it. If I put it in another way, suppose we are able to prevent kidney complication and eye complication in all these 600 people. Okay. Otherwise, 1/3 would have definitely developed complication. That's the rule of thumb. So out of the 600 whom we are treating, let's say without this foundation support or without the charity being given, let's say 200 of them had developed kidney complication. Just imagine 200 people needing dialysis, 200 people going blind, 200 people having a heart problem, 200 people losing their limbs due to uncontrolled diabetes within this cohort itself. I'm just being conservative. 1/3, I'm saying. You can make it 1/10 if you want. Okay. Even then, 60 people going blind within this. Okay. 1/10 is a very, very small estimate, So if we are able to, let us say, all these 600 people, we gave them the full eyesight, we gave them, kidneys which are okay, heart is okay, nerves are okay, everything is okay. I think that's a huge contribution. In fact, today I had a little bad news also. One of my oldest surviving type 1, patients passed away. And I have when she finished, she had diabetes when she was 3 or something like that. And then in 1950s, she got it before I was born, And initially, my father was treating her, and then after that, I got to treat her. My daughter has treated her. So 3 generations in our family have treated her. When she finished her 25 years of diabetes, we honored her. When she finished 50 years of diabetes, we honored her. When she finished 60 years of diabetes, we honored her. And finally, when she passed away, her husband sent a note saying that you have meant so much to our family that she passed. She didn't pass away due to diabetes, something else. She was about 75, 76 years old. And she's been my longest surviving person. She had no complications. She had no retinopathy, no nephropathy, nothing. 3 generations of diabetologists have treated her.
Treated them.
And after 75, she passed away. So I was thinking she could have lived a few more years today when I wrote that, and I sent a message to her husband saying that I really feel sad. I didn't know when she died, and only because of COVID and all that. Something now he has written saying that last month she passed away and all that.
But in that's such an excellent message, sir, that despite type 1 diabetes, you can lead a full life.
Exactly.
And that is an awareness that is something that we want more and more people to know, more and more people to understand. And even with type 1 diabetes, you can move forward with life and achieve so many different things. Just the other day,
she's a grandmother. She's lived, and none of her, the next siblings and the others in the family, nobody developed diabetes, and she was there as a grandmother. She was a very, very loving person and had large family which she brought up. And so, I think you hit the nail on the head, because you see, if you take India's lifespan today, it is 67 years for males and 69 years for females without diabetes, without anything. Average lifespan is 69. Okay. She has crossed that, and she's gone another 6 years, 7 years beyond that with type 1 diabetes, And maybe COVID, I don't know what it was which actually led to her death, but if she could have even lived longer, I mean, maybe 80, 90, she could have lived with the type 1 diabetes. And how many people in India know that child, a lady, it's a girl, imagine when she was so young as a child, she got it, and she lived to become a mother and a grandmother, and live up to this a ripe old age, of 75. Yeah.
And diabetes treatment has changed so much. She must have seen it all. And
yeah,
and
imagine that time there would have been no glucometer. The urine test was there, Benedict solution. You put 8 drops in a copper sulfate kind of thing, and then you shake it and heat it and changes color. That is the only thing. There's no glucometer, nothing. You go to a lab, then you can get a blood sugar done. From there to glucometer. You can imagine the kind of syringes she'd have been using. Some long, big syringe with glass syringe.
glass.
You boil it again and reboil it and reuse it and all that. Then she would have gone through the stage where plastic syringes came, disposable syringes came. Then some stage pen would have come. Then she's gone through all that. I remember last year or something, I put an AGP for her. I said, after 70 years, let's see how your AGP pattern is. It was not bad, just maintaining quite good control.
And compared to that, I think we can give access to very good treatment for type 1 diabetes today to all patients. And to all the people who are listening in, please follow our social media handles at Hinduja Foundation, at Dr. Mohan's, at our other partners, KEM, because a lot of these stories of patients are forthcoming, where patients have lived full life. Recently, we did Sports Day, where T1D and sports. Before that, there was this gentleman who was a marathon runner, Dr. Mohan. He had come and given a motivational speech to all our kids at Friends Forever. So, exactly. So I think the message here is that despite T1D, and in some cases, because of T1D, it becomes a motivation factor for people to reach their best potential. T1D is a condition that can be conquered, and through our group and other patient advocates and other groups working in this space, we're all hoping and championing all the T1D patients to live life at their potential. Yeah.
You're absolutely right. There are a couple of questions here. I'll take that, and then I want to come back to how, from your perspective, since you're not only a doctor but also you've done business management and so on, how COVID has affected the healthcare scenario in India. Is there any silver lining in that? And also, how do you see the private philanthropy and charity driving public health in the future? Is this going to be, are there many other institutions like yours, and how it goes? I'll come back to that, but there are two quick questions. Mr. Vikas Sood has asked long time ago, and I'm just going to reply it now. What is the correct procedure to take insulin injection in the stomach? Because the best place to take insulin is in fact the abdomen. Okay, it's not the stomach, it's the abdomen, the abdominal wall. The reason is two or three. Number one, the number of nerves in the abdominal wall is very much less. What happened? Have we lost you, Ashish? Okay, I think he'll come back. Ashish, you can join back. So let me continue. The best part is the abdominal wall, because number one, it is big. Number two, the nerves are very much less. So you don't, get the pain of injecting on your hand. It's the most painful area. Next painful area is the thigh, and the least painful area is the abdomen. So you can inject there, and you can start in one place and then go from here, there. You can go round the whole abdomen. You can go round. That is called. Welcome back. We lost you momentarily. So sorry about that. So I was just telling Mr. Vikas Sood how to take the insulin, and also, so that's the first thing. It's convenient. It is a large area. Number three, because it is so close to the abdomen where the pancreas and the liver and all that is, the speed with which it works is much faster. So you get much better results when you inject in the abdomen. People think when you inject here, it's going to go right into your stomach. No, that is like 1 foot inside. This is like few millimeter, you're injecting only into the skin, into the just below subcutaneous area you're injecting. So nothing will happen. People used to say, can pregnant women take that? Even they can take, because you're only injecting in the thing. You're not going to go and hit the child. If the needle was that big, you can imagine. Here, the needle is like a microscopic needle. Nothing, only into the skin you're going. So nothing will happen. So that is a correct way. But rotation of sites is very, very important. Ravi Shankar Krish. Hello, Dr. Mohan. Good evening, and you're doing a great job. Is there any way we can contribute to charity? Ravi Shankar, that's so kind of you. You know, there are very few people who even see this program would, will even think of a thought like that. Please get in touch with me. Cynthia, you can type our email ID and maybe some phone number in which Ravi Shankar can contact us. Hinduja Foundation is now, of course, our largest supporter, but we do have others. For example, CAMS is supporting us, and there have been other private donors who are supporting. We have the Manian family, you know, the Ranjini Manian and in her mother's name, Mr. Manian and Ranjini Manian. So in her mother's name, on her birthday in April, she has donated a fairly sizable sum to keep apart as a corpus, and from the
Very nice.
interest from that, we are going to treat 25 girl children with
Nice.
diabetes, because they are very much promoting, championing the cause of women. Ranjini Manian is totally committed to that cause. She takes very poor women and then teaches them, gives them a job, and she's amazing. The work that she does is really amazing. We said that we will, specifically for girl children, we will give, and 25 children are being supported by them. So like that, whatever you would like to do, we'll be more than happy, and we can tell you who is the person who's getting treated, and you can meet that person also. Vijay Goli. Good evening, sir. I would like to know how type 1 diabetic patient lives a perfectly healthy life. I just told you about one of my patients who has lived up to the age of 75. I think, many people, you should listen to the program. Tomorrow you'll be hearing, Nish Amarnath, Nischinta. She has type 1 diabetes. She's now in US. She's a best-selling author. She's a journalist. She has, in addition, she has rheumatoid arthritis, and she's going to talk about all that. See, these are people, who are willing to come on, in a public platform, and they're not hiding their illness. No, I'm not going to tell anyone. They are coming forward and saying, "Look, I had this. Not only you have only type 1 diabetes, I've got rheumatoid arthritis in addition." Now, imagine having rheumatoid arthritis affects the hands, and to become a writer with that, a journalist. Her mother is also a journalist. She is also a journalist, and tomorrow same time 7 o'clock, she is sharing her story. She's into the New York bestseller list. One of her books, Victims for Sale, is a very famous book which is written, and she's so young. She just started her life. In fact, about many years ago, she wrote one of her first books when she was just out of her teens, I think, and that became a very big hit. Of course, she's got it in her genes. Her mother is also a writer. But these are all success stories, of how people have not let any illness or disorder, not even illness. You don't allow the disorder to cripple you or to bring you down, but use that as an opportunity to actually become, not only make themselves better and become successful and happy, but also motivate others. The reason now, for example, Nish or Jazz or anyone came on this program is because they want to share their story, and that's exactly what we are saying, that you don't have to worry at all, and all people with type 1 diabetes should have a healthy life. I think if there's one thing that the T1D1 project would like to show, is to tell the world that despite type 1 diabetes, you can have a long and healthy life, successful, happy, healthy, without any complications. And I'm waiting for the day when my first person with type 1 diabetes crosses 100 years of age. Okay, my type 2 patients have already crossed. 2 or 3 have crossed 100. About 400 patients have crossed 90 years of age, and I'm waiting for my first type 1 person to cross 100 years of age. That will be, and next year's 100 years of insulin discovery, 100th year of insulin discovery. 1921 was discovered, so next year is 100th year. So all these stories should actually come out then. There's one doubt by Kalol Chakravarti. Milk is harmful for diabetic patients. No, why should milk be harmful? I mean, any milk, see, it's cow's milk, so it is meant for the cow and meant for the calf, obviously. Too much of milk can have some antigens. And I think the reason she's asking, because there is some study from Scandinavia which showed that cow's milk can produce type 1 diabetes, linked to type
Oh,
1 diabetes. Yeah. So because they didn't do breastfeeding and they started giving cow's milk too early, and it has certain antigens which is not meant for a very small child. It's never been really proven, but for a very small child, I mean, below 6 months of age, obviously, you must do only, exclusive breastfeeding. But after that, I think milk in small quantities is okay. Somebody has written, "Good evening, sir. Continuously watching your live video Facebook page. It's very useful, sir." Okay, now let me come back to Ashish. Almost finished a year, 1 hour now.
but yeah.
A couple of questions. So, how do you see, two things? One is, how has COVID impacted healthcare in general? Has it been, because, for example, big chunks we discovered, no? Suddenly, if thousands of people start getting ill, what do we do? With where are the beds? What do we do? Where are the ventilators? All these kind of came up, not only in India, in every country. US had the same problem, Spain had the same problem, Italy had the same problem. Everywhere they had the same problem. Okay, China had the same problem, Iran had the same problem. So how does this, and is there any silver lining to COVID at all the bad things we hear about COVID, is there any silver lining?
I think the way I see it, I think the country came together to fight COVID. The government sector really stepped up, and so did private philanthropy across the board. There were so many initiatives to support the COVID response of across the nation. Uh, Even at the Hinduja Foundation, we worked on food security for the
Migrants?
marginalized, the migrants, the underprivileged across the country, because there's so much of livelihood that was being lost. We worked on giving medical equipment, PPE supplies to healthcare workers, to policemen, all other COVID heroes, as well as to even journalists and across. And we've supported infrastructure. We have COVID care facilities that we supported for with the Bombay Municipal Corporation
Okay.
in Mumbai as well. So I think the private sector has also supported this fight, and I think the what COVID pandemic has told us, not just in India but across the world, that we need to re-emphasize public health. We need to refocus on building a strong. We, in many ways, live them sustainably, and now is the time for us to to fill the gaps that have become now apparent with COVID.
I know. I think that's a very nice way of looking at it. That the message is said, the government and private work together. The country came together. We didn't worry about which religion you were or what caste you were. It was all helping each other. Good example of that also was when that plane crashed in Calicut. Everybody, the people there throughout the night helping the passengers, taking them out, taking them to hospital. So when a crisis comes, I think the country really comes together. India has always done that. Patriotic spirit is very strong, and so that is something which came together. And as you rightly said, strengthening of public infrastructure, because governments then really said no, that we have to ramp up. How quickly COVID care facilities were set up, COVID hospitals were set up so quickly. The
Absolutely.
hospitals are converted into COVID care centers and COVID hospitals. Although we didn't know much about the disease, who it is going to affect, who is going to get serious, even how to treat it, how to diagnose it, nothing we knew. Still, I think they have done a remarkable job. So I think that is a very good thing. Um, you know,
Absolutely.
uh, yeah, go ahead. You're saying something.
Yeah,
Go ahead.
so I was saying that so much effort was mobilized in such a short period of time in terms of moving through supply chain, getting together, all the medical supplies in place, like you said, healthcare facilities came together, healthcare training of health workers, not just in tier one, tier two, but tier three cities as well, for doctors and nurses and other paramedics. We've also been supporting some of those initiatives because when the crisis struck and the need of the hour was there, I think everybody stepped up the plate. And now we need to keep that momentum, to keep investing in public health, to make sure we are ready. Uh, uh, we stay in a state of preparedness.
Wonderful, wonderfully put. There was one question here to which I will answer that and then link it to the need for awareness. You raised that awareness, and I want to tell one story about what happened in Bits Pilani, and then with that we'll probably wind up. So somebody has asked, how are you helping in the detection of type 1 diabetes too? Because poor people may not get a chance to get the right diagnosis. It's absolutely right. Because how do you know if somebody in a slum is there and they're passing more urine? How do they know it is diabetes? They may not. But one good thing, if you can call it a good thing, is type 1 diabetes doesn't keep quiet. Type 2 can go on for 5 years without your knowing. Type 1, the sugar start going up so high that whoever has type 1 will become, if you don't treat it, you'll become quite sick. So they will go to some hospital. And once they go to the hospital, then the diagnosis, the blood sugar will be tested automatically, we hope. Every hospital, if anybody goes for even a headache, you should check the sugar. So if that is done, like checking the fever or checking the pulse or BP, you should check the sugar. So then they will diagnose. But you're absolutely right. Awareness is very important, and that's the reason why we are doing such programs. On social media, on this, on we are also doing it. You may say, well, Facebook they may not see. Okay, WhatsApp they may see, or something else they may see. Newspapers they may see, or television they may see. This afternoon I was on Tamil television talking about something. So there also we are talking about it. So wherever we get a chance, we are trying to spread the message. So once you spread the message, it's very important. That's why I said I'll tell you this particular story. So we had this, a girl who was treated by me, and then she got admission in Bits Pilani. So her father was very scared. He said, how to send her? First time she's leaving home, traditional family, how to go. But mother said, no, let her go. Only then she will, become confident. Once she's able to live, it's a 4-year program. So I said, let her go. I'm sure she'll look after herself. Let her go. First 2 years went well. The third year, what happened was she started a very active dance program, very intensive dance program. What she forgot to do was to reduce her insulin dose. So she was taking the same insulin dose, and now spending hundreds of calories by intense dance. She started getting into low sugar reactions. Okay, low sugar to low sugar, low sugar. Somehow it didn't strike her that she has to cut the dose and so on. Only good thing she had done, she told her friends, I have type 1 diabetes. If I'm ever found unconscious, give me glucose. So the first day, they couldn't wake her. In the night, she didn't wake up. She's in a coma. And then they had to give her glucose by mouth. And then they called in the doctor and all that. That doctor, he had not seen, at that time, he had not seen a type 1 patient in a hypocoma, in a low sugar coma. So he panicked. And the first reaction was, they said, take the child out. We can't manage children like this in Bits Pilani. So then the parents called me, and then I had a long chat with the doctor and said, this is only type 1 diabetes. If she reduces her insulin, she'll be fine. 2 years she's already studied. She's a brilliant girl. You can't send her out because she had a hypo, And
Exactly.
she reduced her insulin dose. She didn't do it. It didn't strike her. She was busy with something else. She didn't think of this. Same dose, she kept taking the same day. So then what we did was we organized a teaching program for that doctor. He came down to Chennai, where we taught him all about type 1 diabetes. And then from then on, he started, promoting, looking after these children. And then next thing I heard was that there were a lot of children later on who came with type 1 diabetes to Bits Pilani. So I think even in a advanced center like Bits Pilani, with medical facilities, it can happen. So what to talk of a slum or some poor people? So that brings up the point which you were making, Ashish, at some point, saying that awareness about type 1 diabetes should go to schools, it should go to colleges, we should have posters put up everywhere or booklets given, and every child in a school where there is a type 1 diabetic child, we should be able to tell the teachers, the nurse if it is there, the principal, what to do in an emergency. Sometimes the child is simply sitting like that, they'll think the child is not paying attention, maybe a low sugar reaction. So all these things, I think, by constant education, we should be able to do. So I think we have come to the end of the program, and I would like to thank you, Ashish, for taking the time to be with us in this program. We have dealt a lot of social side of type 1 diabetes, which we normally don't do in this program. And also we are able to highlight the wonderful work done by the Hinduja Foundation, supporting 3 major institutions in this country. Hopefully we will be able to spread this message, the learnings from this. A lot of research is also going to come. Once we finish the first year and the second year, we will be able to write up some common papers together and show the impact, the real impact, the impact on the lives of people, impact on quality of life, impact on HbA1c, impact on reducing complications, and as you said, even in the long term, improving the livelihood of all these people. So it's been very, very kind of you to come. Please thank all your directors and the other administrators in the Hinduja Foundation. Hopefully one day we'll have all the 3 groups sitting together and discussing and exchanging notes. So thank you very much.
Thank you so much, sir. Thank you for your partnership, for your leadership, and
To
thank you
give any
for
final
organizing.
message, you can talk, give that.
No, I would just like to say that please feel all the people listening. Please feel free to reach out to us on our different social media handles. We'll leave our email IDs also just after this, so that if you have any queries, if you have
No, Sundar, can you just put that up? If anybody wants to, you have made one slide. Are you showing it? Sundar? You had that one slide. No, there it is. So there it is. Okay, so that's our details. Our email ID, that's mine, and this is Dr. Ashish Bondia, and that's our website, and this is the Hinduja Foundation website, and those are our 2 logos. So you can get in touch with us at any time. It will be there in the video also. So at the end of the video, now this will be stored and it will be available on Facebook as well as YouTube. So any of you who have missed it, please tell your friends to watch this and support everyone with type 1 diabetes. But I think it's a great cause. Thank you, Ashish.
Thank you
And
so much, sir.
good night.
Thank you, everyone.
Thank you, everyone. Good night.